In this video, we're going to talk about sex and intimacy and what you can expect after your injury. The learning objectives are listed above. We'll talk about the different arousal pathways, what having children might look like for you moving forward, adjusting to different change as you go along, and also possible resources that might benefit you. After your injury, you might have varying levels of loss of movement, ability to feel sensations, and sexual reflexes. How this will affect arousal, orgasm, and fertility depends on your specific level of injury and if you have a complete or an incomplete injury. You'll likely have to change how you engage and participate in sexual activity, but there are several options. Right after your injury, you might not have any desire to be sexual at first, but this will likely improve as you heal, learn more about your body, and explore how you can still be a sexual person. People typically get aroused through two different pathways: the reflex pathway or the psychogenic pathway. The reflex pathway occurs in response to sensual touching, and the psychogenic pathway occurs from psychological sexual sensations such as thoughts, smells, sights, or sounds. With spinal cord injury, one or both of your pathways might be blocked. Most people with a spinal cord injury can be aroused by sensual touching. The more sensation you have between your belly button and your upper outer thigh, then the more likely you are to be aroused in your genitals by sexual thoughts, sights, smells, or sounds. However, there are other ways to be intimate with your partner. If you have difficulty with getting aroused, then talk with your doctor. Sometimes changing medications can help because medications that help with spasticity, pain, and depression might contribute to this. Be sure to have open communication with your partner. Share what you might be nervous about, your needs, and your wants. You're more likely to want to engage in sexual activity if you understand your body and discuss these topics with your partner beforehand. Women who have a spinal cord injury can naturally become pregnant, carry, and deliver a baby. So be sure to keep your healthcare team in the loop so that they can monitor your health as well as the baby's. Along with that, you still need to practice safe sex if you want to prevent pregnancy and also to help prevent sexually transmitted diseases. Condoms are typically considered the best choice for both men and women with a spinal cord injury. Talk to your doctor if you're interested in other birth control options. Intrauterine devices, or the IUD, is generally not ideal if you have problems with sensation and insertion, and the pill is usually not recommended because it increases your risk for developing blood clots. Some men with spinal cord injury can get their partners pregnant through sexual intercourse, and for those who cannot, there are alternative options. Keep in mind that this will be a period of a lot of adjustments to change. It takes time to understand how your body works after your injury. Experiment with your partner to get an understanding of what each of you finds pleasurable. Try to remember to have fun. Using humor and being playful can help to make a hard conversation a little bit lighter. Communicating your needs to each other and talking about sex can be challenging. If it makes it easier, try writing to each other instead as a different way to communicate. You might experience a few setbacks when trying to find what works for you. Try to be flexible as you learn to manage these. Talk to your healthcare team about any difficulties you're having. There are ways we can help, such as educating you on medical devices that can help with having orgasms. Another tip is to try to have set times when caregiving tasks are needed and set other times when there is romance without caregiving, like having a date night. If you can hire a personal care attendant to take over some of those caregiving tasks. And if you're not able to afford that, you might qualify for programs that can help. Occupational therapists can always assist with equipment or positioning recommendations. Consult your doctor if you're having any issues with spasticity or bowel and bladder issues caused by sex. I want to share with you a resource that I used when learning about sex and intimacy after a spinal cord injury. This is a book that I read called Regain That Feeling: Secrets to Sexual Self-Discovery. It's written by Dr. Mitchell Tepper. Dr. Tepper himself acquired a spinal cord injury at the age of 20. He talks a little about this in his background and what his rediscovery was like in his book. He has over 30 years of experience as a sexuality researcher, educator, counselor, coach, and advocate. He also has a website, drmitchelltepper.com, that provides various resources, coaching, and a community of support. There's also a project on this website, which is a sex and paralysis video series to educate on topics like comfortable positioning. If you're interested in learning more about that, then you can check out that website and reach out to Dr. Tepper through a form that he has online to contact him. Overall, be sure to reach out to your healthcare team and therapists about any questions and concerns you have moving forward with how sex and intimacy might look a little different for you after your spinal cord injury.